Good afternoon. We're going to start the webinar in 5 minutes. Good afternoon, everyone. Welcome to the Advantage Health Plans 2024 User Group Meeting. We sure appreciate to have everyone online. I'm showing that we've got, looks like about 33 attendees, which is good. We really appreciate you all spending some time with us this afternoon. I'm going to start kind of stepping through the agenda now. Hopefully there won't be any technical difficulties this afternoon, but you know how live broadcasts can be. Just a few housekeeping things. We are recording this webinar, so this webinar will be available for anyone to download either off of the Kimna Group or excuse me, the Advantage Health Plans Trust website. We'll also be sending out a link to the recording along with all of the slides and associated reporting and handouts. The agenda this afternoon, we're going to go through some introductions. We're going to go through the plan's performance and some of the reporting regarding the medical performance. We're also going to step through some of the prescription plan performance metrics. We're going to go through the 2025 renewal and methodology of the renewal. I know that's what a lot of the bankers are in attendance for. Also going to go kind of review the renewal process. We do have an update regarding compliance, and then we're going to review the account management and education team, and then go over the open enrollment timeline. My name is Jay Kempton. I'm the program manager for Advantage Health Plans Trust. I'm hired by the Advantage Health Plans Trust trustees, board of trustees, to manage and oversee your health plan. It is, we call it, it's known as your health plan simply because it is a self-funded plan, and all of the plan assets, trust assets, are owned by the member banks. And those trust assets can only be used for the exclusive benefit of the member banks and their beneficiaries. I also want to introduce Vicki Schmelzer. She is with Strategic Underwriting Solutions. She's going to be here to talk about the renewal and the renewal methodology here in just a little bit. We're very happy to have Vicki on as well today. As I mentioned, the AHP Board of Trustees, these are the banker trustees that run the plan. I serve at their pleasure and follow their directives. We advise the board on how things are going. We make recommendations, but this most definitely is a member run type of program. The Board of Trustees, our chairperson this year is Scott Long from First National Bank of Sterling City. Vice chair is Joey Root from First Liberty Bank here in Oklahoma City. Priscilla Cude is a trustee board member from First Bank in Bethany, from Bethany, Oklahoma. Casey Barrett is a trustee from Texas State Bank in San Angelo, Texas, along with Lane Brandt from Crossroads Bank in Yoakum, Texas. John Gorton is a trustee from First National Bank of Chickasha here in Chickasha, Oklahoma. Evans McBride, a board member from First National Bank and Trust of McAllister. And Carol Farrell from, she's an advisory trustee from Quail Creek Bank here in Oklahoma City. A new advisory trustee is Frank Leone from Stockman's National Bank in Cotulla, Texas. And then lastly, our third advisory trustee is Barry Anderson from F&M Bank, Guthrie, Oklahoma. Thank you all very much for all of your service to the trust. Performance and reporting. Like I had mentioned, the everything that I'm going to go over will be sent out to you along with some additional detail. We've tried to pare this slideshow and presentation down a little bit so we can hopefully get out in an hour. But there will be more detail that will be provided in a packet that will be emailed to all attendees in just a couple of days. Medical and prescription drug costs in the form of claims. Just through the year since 2016, You see the blue part of the chart are the medical claims, and the green is the pharmacy claims. Pharmacy in this industry, in the healthcare industry, health insurance industry, is becoming a bigger and bigger part of the overall health plan spend. I can remember years ago, if you ever had prescription claims more than, say, 20% of your total health plan spend, then something was wrong. You were overspending on pharmacy. Today, it is typical to see pharmacy running roughly 30% of overall health plan spend, and that is going up. It is the biggest cost driver and inflationary aspect of all group insurance plans. And we're starting to see more and more large claims, catastrophic claims that are related directly to drug spend, and that just didn't occur a few years ago. After COVID, after 2021, we have seen a pretty good reduction in overall spend, which has been wonderful as it really shot up in 2020 and 2021. We are starting to see things trend up a little bit in 2024 though, and over there on the far right, that graph for 2024 is only through August. So we still have 4 months to go. Claims versus contributions. This is just dollars in, dollars out. So total trust expenses, which would include claims and fixed costs, versus annual premium or contribution levels. As you can see, during 2019, 2020, and 2021, the trust was actually in a deficit spending mode. That has turned around in 2022 and 2023, and so far in 2024, we are starting to see again the medical and RX claims are starting to trend up a little bit in 2024, but they are definitely down from where they were earlier in 2019 through 2021. Total net assets available for benefits. This is essentially, you could call it reserves, reserves between the reserves that we actually pay claims out of on a regular basis versus the catastrophic reserve that is there to protect the plan from outlier claims. This is total cash available. As you can, and in the other chart or other data point here is the reserves that are required by the Oklahoma and Texas Department of Insurance. You can see during kind of the heat of COVID in 2021, those total trust assets got really close to those minimum reserves required by law at roughly $7 million. That is also the time when we had the increase in 2021 in January, and then also one in July. You can certainly see why that was necessary. Since then, 2022, 23, and 24, we have certainly seen an increase in total trust assets, which is great. And being that Advanced Health Plans is a not-for-profit self-funded trust, those dollars of surplus do not go off to shareholders or are not seen as profit for anyone. They stay in your trust to help offset medical claims going forward. In 2024, we're at just around $17 million in total assets available for benefits, which is a very good thing. I can tell you that post-COVID, the board is definitely in a mode where they are wanting to hold more assets way in excess of what is required by law. Just like, you know, bankers that had been through the 80s may be a little bit more conservative once they got through that. Kind of the same thing running this trust. I think that holding a higher surplus definitely seems to be the mood of the trustees, and is also supported by the actuary and by the Kempton Group as well. KPP free, Kempton Premier Providers, as most of you all know, that is really kind of our signature cost containment program that we have. We've spent a lot of time in previous years during this presentation about KPP free, about what it is, utilization, things of that nature. We've really pared those slides down really for time. I think most of the bankers that are on this recording are very familiar with KPP. So what we're going to focus on in a couple of these slides is just KPP growth as far as new providers, and then talk a little bit about missed opportunities. Missed opportunities are simply medical claims that we receive into the Kempton Group for processing that could have been done with a Kempton Premier provider at an upfront bundled cash discounted price versus through kind of the regular billing process discounted through a preferred provider organization or a PPO network. So these are claims that could have been done through KPP. They were available, but for whatever reason, the participant chose not to utilize. I've got 2023 here listed as a contrast. For all of 2023, we had roughly 400 missed opportunities. The average dollar amount of those missed opportunities was about $2,400, with the largest single missed opportunity in 2023 of $56,000. That was the delta between what could have been paid by your trust for that medical procedure, what could have been paid versus what actually was paid. Quite a difference there. 2024 has been a remarkable year for KPP utilization. I'm extremely happy with these results. So far through the end of July, we've only had 52 missed opportunities. I think I attribute that to a couple of things. One of them is better awareness from the banks. I think the bank HR departments are doing a better job of educating and making participants aware. And then also we're starting to see more and more medical providers in Texas and in Oklahoma that are starting to adopt these free market and transparent principles as far as offering their medical procedures on a completely bundled basis, really on a cash and carry basis at really their best available price. So we have more KPP providers offering more procedures on an upfront bundled basis that gives more opportunity and more availability for the bankers to be able to use those providers more conveniently. I think those two things in conjunction have really helped keep these missed opportunities down. Total dollars, total missed savings in a dollars and cents standpoint of $75,000 versus $967,000 for last year. The average missed savings amount is $5,200. It's actually quite a bit higher, so that just tells us that a few of the missed that we've had in 2024 have been somewhat larger procedures, but the more routine procedures are being done by KPP providers, which is great. The largest single missed opportunity so far in 2024 has been $14,829. So again, kudos to all of you out there and to your employees and dependents. We're really doing a good job as far as maximizing the benefits and the savings available to your trust. I do want to highlight a couple of missed opportunities. These were actually from last year, not this year, but I think these are great examples. We see so many times when we do have a missed opportunity, and we will maybe talk about it generically with the bank or in a meeting such as this. Many times, I don't think that the bankers realize what a dramatic difference in price there is out there in the medical community. Sometimes even for the exact same procedure, depending on which hospital. And it's widely known, widely recognized now that in medical, the relationship between price and quality is actually inverse. There's many books out there that can document this in the data. What you generally see is the higher priced procedures are generally of lesser quality, simply because what it shows is that there is less competition. When there's less competition, they can charge more and they don't have to have quite the same eye on quality. But here was a couple of kind of egregious missed opportunities. One of them was in Texas, Medical City, Weatherford. The medical provider, this is for an EGD, so this was kind of the upper part of the body, but similar to a colonoscopy, but for the upper GI tract as opposed to the lower GI tract. The bill charges were $40,000. The PPO network that this participant utilized reduced that bill down from the $39,000 down to $26,000. Not a great discount, but was a reduction. The participant had met their out-of-pocket max, and so the plan paid the entire bill at 100%, paid $26,000. However, the average PPO allowable, so the average amount after discount through a network, the average was actually about $4,000. The average KPP price for this procedure was $1,800. Well, again, this hospital charged $40,000 and the plan ended up paying $26,000. That's pretty eye-opening for a lot of folks. You might say, well, KPP wasn't convenient, but again, the average allowable with other medical providers outside of this particular one, the average prevailing price was $4,000. And again, this was not an emergency. This was not a big catastrophic. This was more of a commodity style medical procedure. And I think it's pretty surprising to a lot of bankers what kind of a difference there can be there. And again, this money is your money, not the Kempton Group's money, not the trustees' money, but actually your bank's money collectively. We also had a CT of the chest at OU Med Center here in Oklahoma. Bill charges of $14,400. The amount after discount, or the otherwise known as the allowable through the Healthcare Highways PPO network, they brought that down about a 50% discount, which is great. You might say, wow, 50% discount, wonderful. However, the average discounted amount with other medical providers, other competing hospitals around the region was $1,400. So you could have paid $1,400 if it had gone to another hospital. This particular hospital chose to charge $14,000. The plan ended up paying $7,200. But you might say, well, what's the cash price? What is the KPP price for a CT scan of the chest? About $500. So again, dramatic differences here. It's eye-opening when you go over these with people that are really not in our business. They react to, oh my God, is that legal even? It's legal and it happens every day. Okay, new KPP contracted providers. In 2024 so far, we've added 31 new KPP facilities, and they vary as far as the number of procedures that they're willing to offer on a bundled cash basis. But this kind of gives you an idea of the footprint that KPP has now in Oklahoma and Texas. We also were able to put together 61 new direct contracts based on a percentage of the medical providers' Medicare allowable. These are contracts that your health plan holds, and when we utilize one of those providers or are navigated to them through a Kempton Care Advocate, again, we get much better pricing through those direct agreements, whether they be KPP free or a direct reference-based pricing style agreement. Okay, RX performance, prescription drug performance. I'm not going to read everything on this slide. Again, you will have this sent to you, but just kind of look through various programs through Livinity, which is our pharmacy benefit manager. They're formerly known as Southern Scripts. They provide really some good savings programs through either network savings or clinical savings, trying to redirect patients from a higher cost drug to a lower cost drug of equal or better quality. They were able to save the trust about $1.3 million. Also there in the middle, we're showing the pharmacy rebates that came back to the trust fund from Lavinity, and those rebates come from the manufacturer. We do receive 100% of the manufacturer's rebates on the drugs that the participants of Advantage purchase. I tell all of my clients, don't get too excited about rebates. All that means is that you were charged too much to begin with, and the manufacturer decided to give some of it back if you utilize their product over a competitor's product. So this is your money anyway, but thankfully we were able to recoup that, and that money didn't go off. The pharmacy benefit manager didn't keep it. It didn't go anywhere else. It came right back to the trust fund. There in the lower section, those are the top 5 therapeutic groups of Advantage that are utilized by our bankers by plan cost. Number 1 is anti-diabetics. Number 2 are analgesics or anti-inflammatory drugs. Number 3 are ADHD, anti-narcolepsy, anti-obesity. Those are all in the same therapeutic class. Migraine products, and then lastly, dermatologics. We do have another pharmacy program known as script sourcing. This is also known as an alternative sourcing program. This is a program in which we are able to source certain drugs either internationally or through manufacturers assistance programs. We've had 88 members, 88 patients that have utilized one of these programs so far through 9 months of 2024. The savings through the manufacturers assistance programs to the trust fund have been about $704,000 above and beyond what the pharmacy benefit manager could have arrived at. And then we also saved about $372,000 through sourcing some of our prescription drugs through what's known as IPP or international pharmacy programs. We were able to source about 174 meds for a total net savings. Fortunately, I guess we do have to pay script sourcing for their services. The net savings to the trust was about $1 million through the script sourcing program, and we will be continuing this program as we move through 2025. Okay, renewal methodology, renewal and the methodology behind that. I'm going to turn the presentation over to Vicki at Strategic Underwriting Solutions to take us from here. Now, Vicki, I understand that you're not actually participating in the sharing of the screen, so you just let me know when you need me to change your slide.
Sounds wonderful, and it's a pleasure to be here with everyone. Try to turn on, hopefully no technical difficulties here either. I'm traveling at a Self-Insurance Institute conference, so all applicable to your health plan. So congratulations on a wonderful year, and that's great information on the KPP, and you know, that's all of you helping control your health plan. So amazing savings there and change from 2023. That's all very helpful. And what I'm here to show you is how all of that plays through into helping you control the cost of the health plan and the premiums that then are generated. So if you would go ahead and move to the next slide, we'll tell you a little bit about how we work for the trust, for the Board of Trustees, and how we make certain that you have a successful renewal. It is the goal of the renewal process for us to go ahead and look at the risk, the premium required to support the health risk of the participants in the trust, and to go ahead and have reasonable rates while maintaining the required reserves. Thankfully, as you saw in Jay's illustration, the trust right now is in a very good position, well reserved with cash available, which is a wonderful position to be in. So the process that we go through is that your actuarial team, again, hired by the trust and works with Kempton, and we look at the claims data and the experience of the group. So Windsor Strategy Partners, Paul and team, look at it from a block perspective, from a macro perspective. How are the trends working? How is medical looking? How is the RX looking? At that same time, our team of underwriters are doing a very granular look and approach to reviewing every member within the group, the prescription drugs, the health history, and getting a prospective risk, looking at how do we think they're going to be doing and what treatment will be needed in the coming year for the conditions that may exist. So while all of that is going on, we then look at and assign an increase category. So we'll go to the next one. So really, this will be in your packets, but if we look at the actuarial and underwriting system, so we use a system to determine that percentage of increase for the overall block. Then we go ahead and each member group is assigned into a risk score, into a risk scoring factor, which transfers into a contribution category. So we set lower levels of increase for the most preferred member groups in the trust, and then we set high end or higher end increases for those with the worst risk going forward. We need to stratify that and make sure that we receive the overall percentage of increase required for the entire trust and block. So one thing to note, so we did do that. We worked with the Board of Trustees. We have the overall percent increase approved at this point. And right now, what we also noticed in preparing for this year is that those that are on the select designs, the members in this design group will have a slightly higher increase, not much, but those benefit designs are not performing quite as well as the rest of the risk group. So if we go to the next, we'll show you how all of this translates into your groups and the trust as a whole. So what you can see here, the renewal recommendation between Windsor Strategy Partners, the actuarial team, and your underwriting team is that the trust requires a 7.14% increase overall to have a successful plan year next year. As you know, there's cost of inflation right now is escalating, and certainly using the increased KPP providers help control costs. You saw how your overall costs were coming down, but we do have some trends, so we have to keep up with the trend. You can see that out of the groups, every member group who is here on the line and those that are a member of the trust are assigned to a contribution increase category. So it is great to see that the preferred risk factor groups are going to be receiving only a 3.5% increase. There are 10 member companies in that category. Those on the select design, again, that are preferred are still getting just a smidge more increase at 4%. So 2 companies and banks fall into that category. In our standard risk factors at, a very good increase of 5%, we have 23 member banks falling into that category. Again, the select getting just a bit more at 6%. And the substandard categories receiving a slightly higher increase as necessary to support the overall 7.14% increase. So if you look at the next slide, I'll share a little bit about, we do some, research and to look at how does this really translate into the market, or what's happening with the other carriers in your market. Well, I'm happy to say that the block weighted average increase of 7.14% is quite favorable, considering that the median increase for group health insurance in 2024 is 6%. And so that is according to the Kaiser Family Foundation. And so the vast majority, with the higher increased costs in prescription drugs, as Jay had shared, in 2024 compared to 2023, the average person increased that cost by 13%. So 6.7% overall healthcare costs increase, and prescription drug by 13%. So coming in with 71% of your member banks are going to receive 6% or lower increase, which is, very favorable considering the median increase is 6%. So we just wanted to make sure and share with you that we, take a lot of time and evaluate every single plan participant. And the board does a thorough job reviewing all of the facts and what we prepare along with the actuarial team and Jay and Reagan and Kempton Group. Everyone's very dedicated to the success of the trust, and these are our findings for this 2025 renewal.
Excellent.
Right.
Thank you very much, Vicki.
Yes, thank you.
You bet. Okay, well, that is Vicki's part here. And so as I step to, thank you, Vicki, by the way, for taking that from the SIA conference. I know doing webinars in a hotel room is always interesting. So appreciate everything. It looked good. You didn't, no dropouts or anything. So anyway, have a great rest of your day.
I'm glad to be here.
Mm-hmm. Okay, so now that Vicki has kind of gone over the trust level increase of 7.14 and also mentioned the risk stratification, which again will be delivered to the individual member banks by October 4th. That is definitely our goal, is to get everyone's adjustment out there by then. Like past years, we're also going to be providing kind of what we would feel is the next logical move. If a bank wanted to change plans to potentially a lower cost plan, we're going to go ahead and provide rates for that potential move as well. And also for some of the banks, probably also the ones in Texas that are still on the Health Smart network. The Health Smart network discounts are really not very good. They really haven't kept up. And so, but they do have a very broad network. And so there are several banks that are still on the Health Smart network, but we are also going to be taking the liberty of providing a couple of options for those banks that are on the Health Smart network. We're going to also provide you with a renewal quote if you were to move to the Healthcare Highways Sync network in Texas. And then also, what would it look like if you were to move to a choice plan that utilizes reference-based pricing as opposed to a network like HealthSmart? Of course, it would be up to the banks to choose, but just wanted to let you all know that we're going to do that advanced work. And you can certainly work with your account manager and or your sales rep to see whether or not one of those options is a good fit for you. We would also want to make sure that there's not any disruption as far as the medical providers that your employees use if they were to move from a Health Smart network to a higher performing network. Many times you move to a higher performing network that can lower costs. People may have to switch doctors, they may have to switch hospitals. And so we will also be providing that information so the banks can make decisions with their eyes wide open. Okay, so also want to go over kind of the medical rate adjustment history going back 9 years, 2016 to 2025. we do this every year, but I think it's always important to see the average medical plan rate adjustment over this 9 years has been 6.7%. You can kind of see it kind of going up and down. Again, you know, the COVID years were tough. Really, 2021 was tough. We initially did a 10% increase in January. It was not enough. That actually caused a change of the actuary. That's why Vicki and Paul were brought on. The trust previous actuary just really missed the mark during COVID, and that contributed to the necessity of that off anniversary increase there in 2021. But since then, things have gotten back to normal and actually have improved quite a bit. But again, we're still proud of a 9-year history of an average increase of 6.7. That is, I would say that's probably right at, maybe slightly below medical inflation, which again is a good outcome. Okay. Moving away from the medical, there's several banks that also have some of the ancillary benefits through either VSP or Unum Voluntary Life, Long-Term Disability, Leaders Life. There are no changes on any of those ancillary products. We were able to negotiate rate passes on most of those, on all of those products. So we're happy to see no changes on those. Now, some of the decisions, some of the changes that the board had deliberated on and made some decisions on, we're going to step through those. We got a lot of feedback on the dental plan this year, and so we brought that to the board, and they made some decisions. So they are going to be enhancing the current dental plan for the banks that are on the AHP dental plan. There'll be some slight enhancements to the dental plan. But probably the bigger news is that we're creating an additional new dental plan option. We're not the best marketing folks out there, so we're going to call it the gold plan, but it is an enhanced benefit on the dental. It's a more robust dental plan. Being that it is a better, more robust plan offering, it of course is going to cost more. So we'll talk about that in a minute. For the Oklahoma bankers, there has been new legislation that has enabled the Insure Oklahoma plan to be utilized and made available to self-insured or self-funded plans like advanced health plans. It has not been something that has been allowed for self-funded plans in the past. The state legislature didn't feel like that was fair, and we 100% agree. So they did pass legislation to extend Insure Oklahoma to self-insured plans. However, the state agency that is in charge of implementing that and making it work, they are behind. And so it is not implemented yet, and it is 100% on the state agency, and they do not have a concrete timeline. As we understand it, if that does come about sometime during 2025, don't believe we will have to wait until 2026 to be able to avail ourselves of it, but we will keep the bankers apprised of the progress. We were hoping that it was going to be live by January of 2025. The board has already approved basically the attempting to be licensed and approved for Insure Oklahoma. So that's done, but the state agency has just not gotten the regs and the implementation of that program completed yet. Making a couple of routine changes to the minimum value plan to meet some of the new Affordable Care Act federal out-of-pocket maximums, really more of a housekeeping thing. Happens every year. And then also a change to the minimum embedded deductible on the high deductible health plans. Also, was good news, it's been a while since the Advantage Health Plans Trust website has been updated, and so we presented a plan to update and enhance that website to the board several months ago. They reviewed that and approved that. So that is in process now. Our target for the new updated AHP website is prior to January 1. So we're happy about that. Again, some of the benefit changes, the housekeeping benefit changes effective 1/1 of 2025, the minimum value plan, the maximum out of pocket is actually going to be decreasing to match the new updated Affordable Care Act maximums. It's never gone down. If my memory is serving me, it is always, the out of pocket's always gone up every year. But being an election year, it's actually going down, so that's good news. Also on the qualified high deductible health plan, those deductibles are going up by $100 from 2024 to 2025. Again, those are federal mandates to match the Affordable Care Act minimums. Now, on to the dental plan changes. I've got this segregated into the standard dental plan, which is the current dental plan, and then the new gold plans. You can see that the rates are changing slightly. There is roughly a 6.7% increase from 2024 to 2025. Now, if we were to leave the benefits alone in 2025, there would be no increase. And calling a dental plan dental insurance is kind of a misnomer. There's really no insurance here at all. AHP's dental plan has always been managed and configured to where for every dollar that the banks contribute, we try to adjust the benefits where roughly those dollars come back out. And so the loss ratio for the AHP dental plan, it's always right around 100%. And as long as it doesn't go over and therefore have to be subsidized by the medical plan, the contribution levels can stay the same. Now, one of the reasons why the costs haven't gone up is, which many of our bankers are very aware of this, I believe, is that for all of the preventative care, the preventative part of the dental plan, the amount or the allowables that the plan pays for cleanings, it's a static number. So as dental costs go up, the amount that the dental plan pays does not go up unless the trustees approve the amounts of the allowables to go up. So you can see that those are the allowables. Those are in the plan document. For instance, in 2024 and the last several years, the plan paid $49 for a routine oral exam, $87 for the cleaning, $40 for bite wing x-rays, $80 for a full mouth x-ray, and $30 for a fluoride treatment. If your dentist charged more than that, then you would see that it's not a copay, it's really a balance bill, if you will. The plan paid X, your dentist charged Y, so you owed the difference. The trustees listened to the feedback that we were given, and we gave that on to the trustees, and we said, you know, hey, if you want the plan to pay more, we're gonna have to increase the rates. And so they felt like, well, it's probably time to improve the dental plan, the standard dental plan a little bit. And so they did increase the allowables for the routine areas of the dental plan slightly, not by much, but for instance, the oral exam went from the allowable from $49 to $52.72. You can kind of see the increased allowables for 2025. A new benefit has also been added in addition to the increase in the allowables on the standard dental plan, and that is the addition of sealants for kids. And so sealants will be paid at 100%, like the other preventative measures for children under 18, and they will be paid at 100%, no deductible or co-insurance, but up to usual and customary amounts. And so we purchase a usual and customary table. There is a chance that if your dentist is a really expensive on their sealants, there still might be a slight balance there. But instead of those being static numbers, those usual and customary amounts, they will go up every single year as those subscription tables are updated by the vendor that we purchase those usual and customary tables from. Okay. The trustees also deliberated a long time that, there are some banks that pay for all of the dental plan on behalf of their employees, but when there was still a large amount out of pocket for cleanings for the adults and for the kids, the feedback was that, hey, the bank's trying to provide a benefit, but it's not being perceived as a benefit. And so they decided, well, we're going to go ahead and offer a new plan that's quite a bit more rich on the preventative side. And because it's more rich, it's going to pay more. We have to bring in more contributions, but not all banks would want to choose to pay more on their dental plan. Some would, some wouldn't. So they said, let's go ahead and offer two and allow the banks to choose. Does the bank want to have the new gold plan with the better benefits, or stick with the old plan, bearing in mind that it has been slightly enhanced? So these are the new rates for the new gold dental plan. You can see they are more than the old standard plan. It also includes sealants paid at 100% of usual and customary, but you can see that the preventative allowables, which is really where we have a lot of the negative feedback, is on the preventative side. You can see that those allowables are quite a bit higher than the standard plan. Where did we come up with those numbers? Those numbers have been set to roughly completely cover roughly 80% of the preventative claims that we see out there. So if we look at all the dentists in Oklahoma and Texas that our bankers are using, 80% of those dentists will charge these amounts or less. But there's still going to be 20% of the most expensive dentists in which the bankers may be out of pocket a little bit. The amount out of pocket will be smaller, but if your dentist is within that 80, along with the 80% of the other dentists, there should be no out of pocket unless they increase their fees with the new gold plan. Since I can't see your faces, I don't know if I'm making any sense at all. I hope I am. If not, please submit questions at the end and we'll try to get you taken care of. So that's the update on the dental plan. Okay. Another new benefit, it's actually we've had it for a few months now, but it was put in the kind of earlier in 2024, but after the user group meeting, and that is a new diabetes management program known as Hey Healthy. It is a telemedicine diabetic management program. It is part of KPP free, so it is paid at 100%. And the way that you get the process started is you simply call a Kempton Care Advocate, tell them your needs, and we will get you everything that you need to sign up with Hey Healthy. Hey Healthy is a group of, again, very high quality board certified endocrinologists. They're actually based in Houston, Texas. They are licensed to operate in several states around the region. We've heard about them through really the self-insured industry. They do work with a lot of large school districts around Texas, and a lot of other larger employers have been utilizing this service for a few years. We've been using it on our non-bank block of business, and they do an incredible job. But if you sign up for and actually have and qualify for this disease management program, again, there's no cost for the participant, and you will receive and you sign up for a 6-month program. Within that 6-month program, you get 4 virtual visits with a board certified endocrinologist. Again, it's virtual. Nice thing about diabetes management is it can be done virtually, because 90+% of diabetic management is really labs and education. And so that lends itself to remote care very, very well. So you get the 4 visits with a board certified endocrinologist and 12 virtual visits with health and nutrition coach. The goal of the program is to get your diabetes under control, and hopefully, again, the goal is to make you healthier and possibly even get off of some of your meds. If you need more than 6 months, you can certainly re-qualify for an additional 6 months, but that will be between you and your Hey Healthy physician. Very happy with this program so far. We've already got several bankers that are using it, and we've gotten nothing but rave reviews. Just a quick review. Again, the best way to start your KPP free or to learn more about it is to call a Kempton Care Advocate. That's really the first step. We also do have a KPP free app. It is available on the App Store and the Android store that allows you to initiate the KPP process through the app. You can receive your KPP free voucher virtually through the app as well. And you can also search for KPP providers through the KPP free app. It's a free app, again, at the App Store. Okay, compliance. We do have a change of compliance services. This is not offered through Advantage Health Plans. It's been offered through the Kempton Group, and it is the 1094, 1095 pay or play services. This is something that we started doing right after pay or play became the law of the land. We did this because there was no one else offering those services at the time, and we felt that we really needed to step up and offer this to assist our bankers with this very burdensome process. Now, flash forward several years, we are seeing that there are a lot of the payroll vendors have really caught up, and a lot of accounting packages and payroll packages, software packages, are either offering or including functionality in order to either do or assist the bank in doing this pay or play analysis. We're getting fewer and fewer customers that have been signing up for this. And quite honestly, we've never been in the position as a benefits administrator to really be able to do this service comprehensively. As for a lot of you all that have used our services for this, you know that we have the data for the participants that are enrolled in your health plan, obviously, but we do not have any data for the employees that you have that are not on your health plan. And we have had to work very closely with you, generally in a very manual and laborious fashion, to be able to glean that information to assist with putting the two pieces together. Plan participants that are on Advantage Health Plans, but then also looking at the participants that are not on Advantage Health Plans. And really, payroll vendors, if you have one or you're using a payroll software or even an accounting firm, they generally do have access to both sides of that equation, and we were finding that they can provide those services at a lower price point and at a lot less friction. So we've made the strategic decision to stop offering that service. We're not going to just abandon this process, though. So when you're using your payroll service or your payroll software, if you do it in-house, or if you're using an accounting firm, if there is anything that we can provide you regarding enrollment in the group health plan, Advanced Health Plans, we are more than happy to assist and provide that at no charge to your third-party vendor that will be doing these functions for you. If you do need any assistance with that, you can reach out to the Advantage Health Plans Trust account manager, Jolie Bowman. That was a hard decision, but again, we just didn't feel like we were in the right position to be able to do it. And like I said, the payroll vendors seem to make it a lot easier because they have access to both pieces. Okay, kind of in the home stretch here, Advantage Health Plans Trust, account management and education. I want to introduce some of you all already know these individuals, but Todd Rogers is our Executive Director of Business Development. Merrick Matthews is our Director of Business Development in Texas. Todd is in Oklahoma. Really anything related to new products or services, whether they be part of Advantage or ancillary benefits offered through Advantage. These are the two gentlemen that you can reach out to. You probably also have seen them at various banking conventions. They try to make every single one of them, and even a lot of the regional events. Merrick and Todd are great guys, and I appreciate, and I think you would behoove yourselves to reach out to them. Also, to introduce the Advantage Health Plans account manager, Joe, you actually have two. Jolie Bowman is the one that is really kind of out and among the banks. You may have seen her in your bank, or possibly she's reached out to you to make sure that things are going well. If you ever have any problems that cannot be resolved through our call center, Jolie is your go-to person for really anything that's kind of escalated, or if you just need to bounce something off of somebody. Jolie can be reached. There is her cell phone number and also her email address. Jolie's been doing a great job, and she also works directly with Shannon Kerr, which is our Vice President of Client Success here at the Kempton Group. I've worked very close with Shannon for 3+ decades. She works with Advantage Health Plans, but also our non-bank customers as well. She assists with reporting, compliance, strategic planning, etc. She works very, very closely with Jolie. And as an aside, Shannon is a wealth of experience. She's actually been a member of the Kempton team since 1976. She is our longest tenured employee here at the Kempton Group, and an absolute well of information and knowledge. So you can reach out to Shannon or Jolie if you ever need anything related to the group health plan. Okay, Kempton Academy. A few years ago, we actually had hired a professional production company to create a series of bite-sized educational videos. They're really roughly 3 to 6 minutes. They're not like me, they don't go on forever. I know I can be a little wordy. These are not wordy. They're definitely concise, very well done, and they are designed to be shared with new hires or individual employees that have questions regarding either KPP free, direct primary care, self-funding, reference-based pricing, if any of the banks are on a choice plan, and they are available for free. You can either access them directly, and this will be you will be getting these slides, and so this QR code that will take you to a private area within YouTube is where these are hosted, but you will not be able to find them if you just search them publicly, but privately, that QR code will get you to the private link on YouTube. They're also available for individuals that sign into their AHP portal. Not just go to the website, but go to the website and then click on member resources and log in to the secure portal. The videos are also available within the portal. Okay, open enrollment. This is the new open enrollment timeline. October 4th, the individual bank by bank renewals will be delivered, along with some of those options to hopefully or possibly be able to mitigate the cost increase. Even if you got a really small increase, there's potential that you could reduce your rate. if you were to avail yourself of some of these options that are out there, those will be included in your renewals. October 15th, open enrollment starts. By November 1, any plan changes, like adding plans, deleting plans, changing the plans that you are offering, we would like to get those changes in by November 1st. October 15th through November 30th, we will be hosting open enrollment meetings. Again, you can reach out to Jolie to get those scheduled. November 15th is really the deadline for updated subscription agreements. We are going to have updated subscription agreements, which is really the engagement between the bank and Advantage Health Plans Trust. And we don't have contracts, but we do have a subscription agreement, and there is a new version of it out there that's really been updated quite a bit. Not any huge changes, but just trying to keep up with just some of the regulatory changes and really just freshen the language and get things a little bit more in focus. Also, by November 15th is when the benefit selector is due. And that's where you elect or make any sort of changes to the benefits that you offer. By December 2nd, its final eligibility and open enrollment changes are due. Open enrollment ends then on October 2nd. And our goal, as always, is to get ID cards delivered to the banks by January 1, if not earlier. If we meet these timelines, we should be able to get those new ID cards, if necessary, to the participants by the beginning of the year. Okay, call to action. Contact your rep you can contact your rep, or excuse me, your rep will contact you with your renewal. So you will get a personal phone call or email in regards to your renewal, in addition to your renewal letter. We also ask you to schedule employee and open enrollment meetings. We would love to be able to come to the bank and support you during the open enrollment process, and also educate the employees on how best to use the plan. Provide AHP with employee emails and mobile phone numbers. This is always a challenge, trying to reach employees. I think a lot of bankers just assume that we have employee mobile numbers and phone numbers, mobile numbers and email addresses. We generally don't. So again, if the bank would feel comfortable with providing that, of course, we're never going to call an employee with any sort of a solicitation. We're trying to get them to buy anything. It's all, if we're ever reaching out to your employee, it's going to be because we need to discuss something with them, or possibly provide them with a tip to be able to maximize their benefit, or make them aware of, for instance, a KPP opportunity. Adopt a culture of consumerism and cost containment in your organization. Again, this plan is your plan. Those contribution increases, we are able to influence those to a certain degree, but the administrator cannot do it alone. We have to have your help and encourage your employees and their dependents to be aware that the money that these claims are being paid with is the bank's money. And if the contribution increases, if they go up, it's simply due to increased claims expense or increased claims risk. So if we're able to adopt a culture of consumerism and cost containment, that definitely benefits the bank and also indirectly benefits the participants. Share educational materials. We have a tremendous amount of educational materials on the Advantage Health Plans Trust website, in addition to the Kempton Academy videos. If you're wondering if that we have a particular flyer for a particular need, whether it be self-pay claims, utilizing KPP, availing yourselves of the direct primary care benefit, those are all things that we have materials on. We'd be more than happy to provide those to you at the bank. And then again, promote and encourage KPP free utilization. All right, I'm 4 minutes over. but we are going to open it up to questions in the chat if we have any. If there's anything that feel like you don't want me to read your question, or if it's of a sensitive nature, you can certainly email us or give us a call, and we will get those questions answered. So Reagan, I don't see any questions. I don't know if you've received any or not.
We received a few in the chat already, but Julie and I have answered them. So
Okay.
I think at the moment we are good.
Okay, very good. All right. Well, we want to thank you and just tell you how much we appreciate your attendance and also your support of Advantage Health Plans Trust. And we also look forward to working with you in 2025. Things are exciting in the healthcare space, and the only thing that's constant is change, but we'll get through it together. So anyway, you all have a wonderful afternoon, and we look forward to open enrollment with you. Thank you.